Today's module is on cervical facet syndrome, often caused by whiplash injury. It can also be caused by, for example, a fall, any sort of sudden acceleration, deceleration of the neck and upper body. It causes pain into the neck and upper back area. It's often underdiagnosed at first, but that may not be unfortunate because patients will often get better with chiropractic, physical therapy, tincture of time. If they're not better within months after their injury, more specialized treatments, such as injections from a physiatrist like myself, can be quite helpful to reach an accurate diagnosis. Generally, things like MRI scans are not helpful for this diagnosis, and when we get to the history and physical exam portion of this module, I can talk more about other treatments. The cervical facets are little flat-sided joints. Facet means side, like the sides of a diamond. And I'm opening up a cervical facet here to illustrate it. And as you know, there's 7 cervical vertebrae. 1, 2, 3, 4, 5, 6, 7. There's 7 in all mammals, including giraffes, I might add. And after a whiplash type injury, these joints are often injured. The key to remember is injury to or pain from this joint is not seen on an MRI scan. So if a doctor gets an MRI, they may not find, in fact, they generally do not find any injury from these joints. It shows the joints, but doesn't show injury to them. And that's why good clinical skills are important. Also important to remember that depending on which joint is injured depends on where you get pain. So the upper joints, C2, 3, here, there's 1, there's 2, there's 3. This joint, very commonly injured, often causes a headache, starting in the back of the head, sometimes to behind the eye. Whereas the lower joints often cause pain in the upper body. Patients think they have an upper trapezius strain, but in fact they have a cervical facet joint injury. This injury doesn't cause pain down the arm. So what Jennifer would tell me as a patient is that she has pain if it's the upper joint. I'm going to turn your head this way if you don't mind. Pain kind of like this if it's lower joints here. Doesn't go into the arms. Doesn't cause numbness or tingling. Typically on exam there is restriction in neck range of motion, and you can quantify that. There's pain also with neck flexion and extension. They have often focal tenderness. It's hard to do this with Jennifer's hair, but kind of in the back of the neck. I'll do it on the model instead, might be a little easier. In these areas, and you can actually palpate those areas and they'll be focally tender. When you do your neurologic exam and your shoulder exam, those are generally reassuring. So shoulder exam, put the arm up to the side, internally rotate. That should generally be fine. If it's not, it'll cause pain here, but not out here where the shoulder is. Again, remember that with these injuries, like with a whiplash, they could have both a shoulder injury and a neck injury, but we're going to assume it's just a neck injury. We would do our neurologic exam, which we've done before, and it's in a separate module, and that will be reassuring in general. There will be no motor weakness. There might be on occasion when have the patient hold their arm out, they might have a little bit of pain here causing effective weakness, but nothing really that's neurologic. They're often a bit tight on this side, the more affected side, so their shoulder range of motion may not be full. But again, they don't have classic shoulder impingement signs. Treatment, often treatments like spinal manipulation through a good chiropractor or manual physical therapy, massage. Those are often very helpful early on, sometimes acupuncture. In our clinic, we do a lot with dry needling, which involves using acupuncture needles to go into some of these tight muscles. If that's not helpful after a few months and they've got other problems that are not resolving, such as disrupted sleep after trauma, pain interfering with their lifestyle, that sort of thing, I go to more advanced treatments, typically actually in this room where you have a fluoroscopy machine. I'll do diagnostic injections under fluoro. And if I identify 1 or more joints that are injured, we do something called cervical PRP, or platelet-rich plasma, where we take the patient's blood, spin it down, enrich their platelets, which are sort of healing cells, and inject it into 1 or more joints that are injured. If all else fails, there are some procedures that actually will ablate or destroy the nerve supply of that joint. That doesn't really heal the joint, but you don't feel the pain anymore when you turn off that nerve supply.